Again, we're very proud. She is the lead psychologist at our Proof Alliance FASD Diagnostic Clinic in St. Paul. She received a PhD in educational psychology from the University of Minnesota. She completed her doctorate residency in pediatric psychology and neuropsychology at the University of Minnesota Medical School and her postdoc training at the FASD and Neurodevelopmental Disorders Clinic at Canvas Health in Minnesota. In addition to that, she holds a clinical certification as an FASD trainer from the Great Lakes FASD Regional Training Center, and she has been providing extensive training on FASD at the state level, the regional level, and national level. And she just has amazing insights and thoughts and ideas about FASD diagnosis and how to really move the field forward. So happy to turn it over to Julia.
Okay, thank you very much, Sarah, for that warm introduction. I'm going to attempt to share my screen now, so we'll see if we can get this going. Hopefully everyone will be able to see this. Let's see. Okay. So I've got my screen going here. I can see some of you from the side. I'm going to dive right in. I'll hopefully have some time for questions at the end here, but please, feel free if there's a chat box, which I believe there is, put a question in there. We can come back to it, circle around at the end. So today I'm talking specifically about how do we connect and build alliances with healthcare providers with the idea of building future partnerships. And this is, when Susan proposed this topic, I thought, oh my goodness, this is huge. It's an amazing, important topic. And how the heck do I boil this down to a presentation within an hour? So this is me. I'll skip right through that. You know that Proof Alliance is an important part of Minnesota and the work we do with FASD. Our mission, of course, is to prevent FASDs and support those impacted. So with that in mind, I want to talk with you today. I've really boiled it down to a few learning objectives. The biggest piece for me is to empower you in the role you have as an FASD advocate with the skills needed to go out and grow these alliances with medical professionals. And we're going to do that a few ways today. We're going to talk a little bit about a growth mindset, what that means. This is a buzzword term, but it's also a term that's used in developmental psychology, organizational psychology. We'll talk a bit about how we can use that moving forward to build these partnerships. We will also talk a bit about some specific strategies. And within that, I'm really going to drill down and explain how to pitch and ask. Now, this is something that I'm sure many of you are familiar with or have done, but if we can break it down sometimes into concrete steps, it can build confidence and can really help us move forward in all of those instances where we may not be necessarily thinking about making connections, but an opportunity is placed into our lap and hey, let's act on it. Let's move forward and see what we can do here. All right. Spoiler alert, right at the beginning, I don't have all the answers, and you probably don't either. This is why it's an important topic for us to continue to discuss and build confidence around and come back to every once in a while. I'm hoping that, again, I help to build some confidence and give you some specific strategies, but really coming at this from the place of, let's all work together. And if there are more specifics, we're here. I know Proof Alliance would be happy to help talk with you more about what that looks like for your organization and for building whatever it is you're looking for within your community or state. I think it's also important to know that, you don't need to be this work some sort of magic or have amazing rhetorical skills. We don't need to have powerful personalities or be highly persuasive, but the fact that we're passionate about this and have an interest in creating connections is really what the advocacy is all about. So it really boils down to being able to make those connections in a meaningful way where we're consistently building relationships with providers. So to that end, we'll talk a bit about specific mindset, a growth mindset. And you can see here, I've got a garden on one side and some carpentry on another side. And so to lay the groundwork, I want us to think about what mindset are we using? Are we using a growth mindset or are we using more of a fixed mindset? So are you a gardener or are you a carpenter? And this is something you can certainly take to many aspects of your life. I've read a lot about this actually with child development. Alison Gopnik is a psychologist who does a lot of work about parents' mindset and raising children, but it definitely applies to what we're doing here in building alliances. So when we think about a gardener, obviously we know that gardeners are trying to create conditions for growth. They're planting according to their specific climate, their geography, their own needs. All right, they know that even under the best conditions, some plants are going to thrive, others may not. There are so many variables that are outside of their control, weather, pests, other variables as well. But on the other hand, gardeners know that even in suboptimal conditions, some plants really just end up thriving. And in some occasions, something pops up where you least expected, something amazing. And so there are lots of opportunities there. And gardeners' jobs are really to provide the best conditions possible, tend to those plants, but understand that, outcomes take time, and to really get to the point where the plant is growth is now producing fruit takes a long time and dedication. And carpenters, of course, on the other hand, have a specific outcome in mind, and they take exacting measurements and follow step-by-step directions to create something predetermined. And if a carpenter does not follow the plan exactly, the end product could be compromised or just fail completely. But if steps are followed in the correct order, the product is produced and can be replicated over and over again, following those same directions and same steps. That carpentry can involve a big initial investment of time and sometimes money, but once the product is finished, often little upkeep is needed. The product is done, doesn't change over time. So I'm sure you figure out where our mindset needs to be. We all need the mindset of a gardener as we're thinking about building alliances with clinicians. This is actually a picture of, I live on some acreage. I was talking to Susan. This is a picture of my garden just from a few days ago. But we all need to work to create those optimal conditions, but know that, again, outcomes can be influenced by other factors. We're thinking about planting seeds, but knowing it takes time for those seeds to grow and to see those plants come into their own. And we also know that, we're doing the best we can to build a relationship and buy-in, but with conditions of growth, optimal conditions of growth, things still take time. So we're coming from that gardener mindset, that growth mindset. Now I'd like to talk specifically about the pitch. So if you're in a situation where you're connected with a clinician, you're at a conference, you're on a panel, for whatever reason, you're meeting someone new and you think, man, this is someone who I'd really like to bring into the FASD fold. I think they do important work. They could be, this kind of alliance could be really important to moving the field forward or reaching whatever goal it is that your organization may have. I want to talk about the 3 parts to really hook or bring in a clinician to your work. And we're going to talk about the initial hook and then how to build that relationship and buy-in. And we'll break it down into 3 parts. So with the initial hook, we'll talk about the need, the goal, and the ask, okay? And again, these are things I'm sure you're already doing to some extent, but sometimes having some information or reviewing some of the work that you're doing can be helpful in just building confidence as well. Okay, so when we're thinking about the need, we're really thinking about making the case, okay? So something compelling that's going to be impactful to the clinician's work for them to connect what you're doing to what they're doing. And it could be a compelling statistic. It could be, a relevant personal story that makes sense with the work they're doing and the FASD families that you see. It's something that is going to just pique their interest. And again, it's just a small hook here. You don't need to go into a lot of detail, but having something that you can say, oh, hey, yeah, did you know you see kids, so you see kids with autism in your practice? Well, yeah, we work with children with FASD, and 1 in 20 kids in the US have FASD, which is actually more common than autism. So in your practice, you're likely seeing many kids with FASD over the course of a year. So making that concrete connection between what your work is, what you're doing, and what the clinician is doing, or how you might see them involved, or how they're already interfacing with people with FASD. It makes it more here and now versus then and there. So just putting the need out there, explaining what it is that, a way to hook them, a way to bring them into the fold a bit. The second piece is the goal. And so that's specifically, what are you trying to accomplish? And this is with an eye toward, this is a provider you could, again, bring in to connect with your goal. So if you're talking to a clinician who's a physician or a nurse practitioner who works in primary care, or is a pediatrician, talking about, well, one of our goals is to train clinicians to do screening for FASD, because we know there are so many kids out there, again, that, have prenatal alcohol exposure and are not diagnosed or misdiagnosed. And again, with the goal, it's just more specific about what you're hoping to accomplish, but you're not going into a lot of detail at this point. And finally, the ask, and this is where we can get hung up, especially when it's sort of a cold ask, when we've just met someone, is, we've talked about the need, we're pretty good about talking about our agency's goals, but that ask, that initial ask, we're not asking for buy-in to everything. We're asking for only a couple minutes of the time. Okay, hey, do you have a couple minutes where I could, talk to you briefly about screening? And if you put more concrete parameters around the time, it's often helpful. So 2 minutes versus, the provider's not thinking, okay, we're now having a discussion that's may go on forever about a specific topic. Just 2 minutes about, a small area where you feel there's a connection between your work and what the provider does. You don't need to be changing minds at this point. You don't, all you're trying to do is plant those seeds. So using your own language, an ask can be as simple as, if it were me, I might say something like, hi, I'm Julia, I'm a psychologist with Proof Alliance. And then perhaps the other, clinician, oh, what's Proof Alliance? And I explain what Proof Alliance is and what we do. And let's say I'm talking to another pediatric neuropsychologist, I might say, as a pediatric neuropsychologist, you're already trained in the test measures really that are necessary to do FASD diagnostic work. It really would just be, shifting that lens a little bit to include diagnosis. And that's something that, you could be trained in pretty easily. Do you have a couple minutes to talk about what that might look like for your practice? So again, a small hook, just getting them thinking about what that might look like for their practice. And really your only goal here is just to take a couple of minutes of their time to plant a seed. Again, we're not asking, no big asks here, just a couple minutes of their time. And if they don't have a couple minutes of your time, or the 2 minutes are over and you'd like to continue the discussion, then it's time to schedule something. Then it's time to do the second part of the ask, which is, hey, would it be okay if I contact you in a week, just to set up a brief, discussion, 15, 20 minutes on what this might look like for your practice. You can say I can answer any questions you have at that time. If you have information to share, this is a good time to leave it with them. You've got now a connection. You've hopefully got a second just brief appointment scheduled, or you will connect to schedule a brief appointment. But again, we're only asking for brief amounts of time moving forward. And that's the ask, okay? So we're not asking for a lot. We're just asking for time, planting very specific seeds about, ways that they might get involved or what this could look like for their practice. So the next step really is getting more specific on the follow-up. And that may include having that 15, 20-minute meeting. That may be, specific to having an email discussion with them. But where before the goal was general, we're interested and we'd like to get more providers interested in or doing FASD screening within their practices. Now we want to drill down a little bit, and we want to make good use of our time moving forward with that professional as well by having a specific, actionable, measurable goal. Okay, so how do you see their work and your work meshing? What is your goal for this clinic or this provider? And I think it's a good idea to always have a goal that's specific, actionable, and measurable, because if you know what you're working toward, you're more likely to talk toward that and work toward it within the meeting, rather than getting distracted or sidelined by what's going on in their practice or what you're doing, or, you're more likely to move in that direction. And if you put it out there, you're more likely to, now we've just ramped up and we're not having meeting after meeting circling around a goal. We've got a specific goal. They can give you input on that piece. The tricky part is that the more specific you are with your goal, you also have to be real open to possibilities, because while you want to be able to move this forward and keep the relationship going, and we all know death by delay, email, back forth, things don't progress. We also have to be open to where the clinician is and what's going on within their practice. So that's where productive advocacy really comes into play. So this is a term which basically means that you're an expert in your area and you have this goal or this idea, and you're taking it to someone else saying, this is my perspective, my take, and my understanding, but I'd really love to partner with you to see what you think. So it's getting their opinions, their interests, their reactions. And that is going to help build the relationship, number one, and it's also going to keep you open to where their clinic is. So let's say you had talk to this provider, come to this clinic, and with that specific goal of really wanting to build screening practices. And the clinic is open to listening to that, but they say, we just actually got this grant, and it's to support Native American Indigenous peoples through enhanced care coordination. And we'd really like to get more training in that area for our care coordinators. So being able to pivot and say, okay, let's talk about that. Let's, that's an interest, that's an area where you have need. Let's talk about that. So again, having a goal, but trying not to be specifically invested in a particular outcome, being able to be flexible and work productively together with the clinician as well. All right. Before the follow-up meeting, this is a big one. All right. If you're going to spend your time preparing or practicing and how you handle situations, this is what you need to do. Pushback is normal. I really say expect and accept resistance. Okay, it's normal, and in a way, it really means that the clinician, the clinic, whoever it is, has thought about your ask. So if they haven't thought about it, you're just, at least they're thinking about it is the biggest piece there. And it's also normal because they're thinking about how it's going to work for their system. It is going to happen. It's okay that it happens. And honestly, when you think about it, having this back forth, okay, I'm not sure how this is going to work. Okay, I'll share some information here. That is productive and can build buy-in as well. It's that joint collaborative problem solving. So what I would recommend is, as we're sort of practicing our brief elevator pitch, also thinking about how you would address barriers. And the more common barriers we all know include clinicians come back with, we don't have time, the funding, how comfortable we are with screening for FASD, knowledge of FASD, diagnostic complexity questions, like how do we do this? And referral sources are some areas that you can really think about. How would you, if this comes up, how would you handle this? What could you say? Again, we can't cover, you're not going to be able to prepare for every specific, barrier or situation, but you can also come back and let them know that, I'm not sure yet, or I don't have information on that specific situation, and I can get it. I know this person, or I can connect with that person, or I'll have this person call you. So it's, I'm not sure, and I'm going to circle back with you. So when you're in a situation where you're talking to a clinician and they are coming up with some pushback or a barrier or something, as you're just wondering about how something's going to work, the strategy that I think is really useful is to address the resistance head on, first of all. So repeating or rephrasing what the person is saying and validating it. Because yes, these are big concerns and they can get in the way. And then sharing your perspective from what either your expertise or what you've seen other clinics do or how other medical professionals have handled this. And I'll give some examples here. Okay, so I like the phrase inviting and taming the lions. I read a little bit to prepare for this. John Cotter is a Harvard Business School professional, and he's written some books on sort of buy-in and what that looks like. And it really is this shift in mindset too, where you're going to have resistance, and that's okay, and that's normal. And actually conflict can build relationship, or, you know, that joint problem solving can really build relationship. So here's a brief example. Let's say you've had this initial meeting with a clinician, they've reviewed some things, you're really thinking about, you're wanting to build screening in this clinician's office, you'd like to get this clinician trained on screening. And the clinician might say, you know, I still don't see how I can add this to my already time crunched visits. And what you're going to do again is repeat, you know, what they've said in your own words. I hear you saying you don't have enough time in your practice, and then validating it. It's got to be hard to fit it all into one visit. Yeah. And then coming with from your own perspective. You know, most physicians I've worked with find that once they're comfortable, asking those 2 to 3 screening questions adds very little time to the appointment. So using that strategy of, you know, repeating in your own words, validating, and then coming from your own perspective in order to address the barrier. And, you know, I gotta say, I've used this before. Here's an example again, where I've talked with, this is a psychologist who I believe was in private practice and worked with families that, I think she took private pay. I worked with families from high socioeconomic backgrounds. And she kind of did a twofold. I don't think parents would be comfortable answering these questions. Also, I'm pretty sure I don't see kids with prenatal alcohol exposure in my clinic. And, you know, my answer, I'm sure, was something like, you know, I hear you. So again, that validation, it's not always easy to ask about this topic, but also then providing some education and providing your perspective that people from all backgrounds can and do use alcohol before they know they're pregnant. And I found that most parents are open to answering questions about their pregnancies when it's clear that the goal is to help their child, not to judge their choices. So again, thinking about using that type of approach for addressing barriers is going to help you. And then coming from the mindset of, you know, these discussions are going to happen, and that's okay. And that actually can be productive and relationship building as well. Okay, and when you're having those initial meetings too, so you've talked about your ask, you've talked about some barriers perhaps. What you want to do is you just don't want to leave it there with the kind of the response being, okay, well, we'll connect sometime in the future. No, you really want to keep this moving forward as much as possible. So whatever you can do to make links to move forward, be it you're scheduling a follow-up meeting right then and there when they're motivated, you've had the discussion, you know, they're more fired up or they have more interest. You are handing off, if you can, to an identified FASD champion who is going to follow up. But there needs to be a point person, or there needs to be a meeting, or there needs to be something scheduled for follow-up, because, you know, as I'm sure we all know, we get some very motivated folks in, and, you know, we have these great discussions, and then you're connecting maybe a couple months later and you're just not in the same place. That window is passed. They're busy onto other things, or that energy and excitement is just not there. So I give an example here. Mary Jo Spencer, as I'm sure a lot of you know, is a nurse practitioner we work with at Proof Alliance. But being able to pull someone in who has that medical experience and can help them build confidence that, yeah, this is something you can do, and we can help you problem solve around this, can really be helpful for making that link to move forward as well. But with this follow-up meeting, being sure that there is a specific concrete link, whether it's someone is going to call them and follow up, or another meeting's been scheduled, so we don't lose that energy and that momentum going forward. And then tips for success, things for us to think about. I get really hung up on details. Personally, I have to keep things, I have to remind myself, no, we can go there another time. No, we don't have to talk about that now. We don't have to have it all figured out. We just need to try to keep it simple, straightforward. You know, think about your ask, think about the barriers they have identified and how you can move forward. And really focusing on those small asks as the relationship builds, because those big asks can come, you know, the bigger connections and alliances can come, but generally they don't come first. Generally you've got to have that relationship. The smaller pieces, okay, we'll have one person that is trained in screening here, or we'll do one or two smaller tasks or connections versus really getting into some of those bigger things. So using that foot in the door technique, focusing on the smaller asks, that may be where you want to start. And then, if possible, obviously, when energy and motivation are high, incentives can help to keep them going when possible. But again, these tend to be things that you want to have that are now, or can be acted on soon rather than later. So things such as, oh, we have this training coming up, we could get you registered for that, or we have this conference and you can get continuing medical education at a whatever it is you can offer that makes sense and could continue to move the relationship forward can be helpful. Obviously, you've got to be real careful about incentives and make sure that this is all okay with organizations, but those types of things can help build engagement too, if there are grants or other things that can open the doors for that continued relationship. And then we all know follow-up is so important. I mean, the fortune is in the follow-up is a phrase that I think cannot be understated here, because this is about relationship building. It's about planting the seeds, but you don't just leave them there. You've got to tend to the seeds. You've got to grow the relationship. So follow-up, while it's not always easy to do, is necessary and going to help build these relationships. All right. So what happens if you get a no, or you get kind of shut down, or you're ghosted? Know that a no is rarely never. And this is also a growth mindset shift. No is not never for most, asks. No is not now. Okay. So you can always come back with not a problem, or I understand, can I check in with you, and then give a time frame to see if whatever the ask was might be possible then. And then as much as possible, keeping that person in the loop, whether it's, oh, we have this conference or training coming up, just thought of you. Would that be something you're interested in? Or, hey, I just read about this research and it connects with the work you do. Thought I'd share it with you. So continuing to follow up, but knowing that, if a no is there, that's fine. And let's continue the relationship. It's okay. That's okay. Because sometimes it takes a long time, and a lot of now is not the right time. No, I'm sorry. Oh, I can't make that, before we get a, yeah, actually, I'd like to check that out, or I'd like to be a part of that. So know that we're thinking kind of the long game here, and continue to follow up. So that's putting alerts in your calendar. I mean, it's putting specific dates out there. I will follow up with this person at this time, because otherwise, again, any kind of early growth can wither. So that follow-up is definitely in our court for the foreseeable future, until that relationship is there and strong. But it's such an important piece of the work that we do in building these alliances. All right. I want to talk just a little bit about the approach. I've been talking a lot about ground up approaches. So planting seeds, individual providers. Certainly, we all know that ground up and top down approaches are both necessary and helpful. Changing systems is not easy, but it's also a real effective way, if you're shifting an entire system, to build a framework that's more stable and steady and going to be there whether providers come and go. So, I'm talking from more of this ground up approach, but know that if you have the ability to change systems, obviously you can take a lot of this information to the systems level and apply it there as well. What we found at Proof Alliance, and because we've gone through both approaches, sort of top down and ground up, both approaches are certainly necessary. But when we started, Sarah gave me some information here about when we started 17 years ago with funding through the state. There were a lot of different approaches tried, and A lot of it was sort of supporting or filling in gaps for already established clinics. And a lot of those approaches, unfortunately, weren't sustainable once the funding dried up because the system hadn't really adapted. It was the same system with additional funding. And when the funding left, that first system was still there. So if you're going that systems approach, it's really got to be able, you've got to be able to think about how you're going to shift that system into sustainability, okay, rather than just infusing funding. And so, I mean, where we're at right now with Proof is obviously the systems approach is still present in many ways, but in terms of our clinic, what we did, Proof really decided to do is try to figure out how to create more diagnostic capacity by using our own clinic as a bit of a lab, okay? So not that we're just going to make this huge clinic and be able to address all of the diagnostic needs for everyone in Minnesota, but how can we build best practices, efficiencies? How can we be a center for training and outreach? And that's what we've done. And the approach then is really to think about how we can equip professionals along the FASD continuum for screening, referral, diagnoses. And one of the things that we've done is we brought in a psychology postdoctoral fellow. He gave me permission to use his picture here. And we actually, what we did is he had a research fellowship at the University of Minnesota, and he had experience doing clinical work as well. We were able to buy out about 12 hours of his time to come from the University of Minnesota and do FASD diagnostic work with us. So he already had some experience with FASD, but he learned more about the diagnostic process in Minnesota, was able then to, by the end of his fellowship, independently do FASD diagnoses. And he took his skill set, his clinical skill set, and went to a pretty large community mental health center here in Minnesota that serves a lot of children with autism, and I'm sure many, many children with FASD as well. They've got about 4 clinics here in the metro area in Minnesota. And as he was transitioning there, we started getting calls from this clinic saying, hey, we'd really like to get all of our clinicians, our psychologists that do pediatric neuropsychological evaluations trained in doing FASD diagnosis. So I think it was a culmination of a number of factors, but I think this was a clinic that FASD had kind of been on their radar. They've made connections with our organization in the past, but it had never gotten to that point of growth where they were ready to move forward and build in FASD diagnostic services, even though they very much knew that they were seeing kids with FASD within their clinics as well. But it took Eric, who was our champion, and go there they had a point person now. They had someone to rely on who could bring practices to them. They were ready to, replicate what he does within their own systems as well. So we felt just really great about being able to train him and let him go. He went out, he did it, take that work out into the community. And now we've got another large clinic system that sees a lot of kids that'll be able to do FASD diagnostic work as well. And we have another new postdoctoral fellow coming in, and hoping that, again, we can replicate that to some extent where this next fellow would be able to take that out as well. And I think trainees are from now practicing for over 10 years. I look to trainees to, they have fresh ideas. They have a lot of information on new diagnostic services, training, new research. And I really love that fresh infusion of energy and information. And so, I see it as a win-win. And I know that, training young, whether it's residents, postdocs, or interns, can really be a way to build that sort of champion mentality and have them take that out for next steps. So that's something that, again, we're hoping to replicate and continue, and hopefully will help us grow our diagnostic practices here in Minnesota. All right, I'm wrapping up here, but I wanted to say that, I gave some information on some things to think about, some strategies to use. Obviously, this isn't going to cover specific situations on, how to connect the work that you do with making and building specific alliances. So if you're looking for more information, if you're wanting to know, okay, we have an idea for screening, we have an idea for diagnosis, we have this model we'd like to use, but how do we get started or implement things? Proof can help with that. And I have got, I think Kendra's on this meeting as well, but I have Kendra Glutt. She's our Director of National Programs. I have her email here as well, should you want to move forward and talk in more specifics about some of these topics that I've mentioned today. But I will, at this point, stop sharing and I will open it up for questions and discussion, really, because again, this is something that I think is a learning curve for all of us, and we're all really trying to make sense of.
Yeah, or Kendra, perhaps one of you could talk a little bit about our Diagnostic Consortium. I think that that's been an effective tool and to build that kind of FASD community in clinical community in our state. So maybe one of you could talk a little bit about that and in how that has worked.
Sure, I can. So as Sarah mentioned, we do have a FASD Diagnostic Consortium in Minnesota, and it really is an opportunity for the different clinics that are providing FASD diagnostic assessments to come together and just have that dialogue that usually we aren't able to get. And so sometimes there's new findings or new guidance that has come out that we can discuss and share amongst ourselves. Sometimes it's a question that someone wants to bring to the community of how are you doing this? Of course, over the pandemic, a lot of it was how are you transitioning pieces to telehealth and what does that look like in your clinic? And so it was really helpful as we all went through some of that to be able to touch base with each other. And it's great too, as Julia said, if there's a new clinic that's interested and they're not, maybe doing it yet, but they want to learn more, then they can come to that meeting and, find other people to connect with and learn more about what it looks like in their setting. And it really is a variety of settings that are doing FASD diagnosis. So some are just doing the neuropsych testing, and then they partner with somewhere else that does the physical exam. Some are large systems, some are very small clinics. So, we open it up to whoever is doing it and wants to be part of that discussion. And so that's something that might be of interest, outside of Minnesota. Previously, it's just been in the state, but that does provide a nice opportunity for some of that, especially as we're seeing FASD diagnosis evolve and possibly more settings for it to start to happen. So yeah, that's one thing. And I would also like to mention, as Julia talked about screening, if people are interested in screening as kind of maybe a first step, they're not looking at diagnosing FASD yet, but they are interested in screening. We do continue to have this HRSA grant where we are doing this ECHO model of working with clinics in a learning collaborative over 10 months to really help them change their practice and screen for FASD within their practices. So we have our cohorts that are participating right now. We have 13 clinics from 7 different states. And it's a really nice model. And we're going to be enrolling people again in the spring of next year for another cohort. So if you're starting to have these conversations that Julia talked about and planting the seeds, this is something that they could participate in virtually from their place and, again, join others in this experience of all, looking at what it takes to do this work. And then, of course, screening might be one step in the direction of then diagnosing FASD too. So just wanted to mention a few of those opportunities. And like Julia said, I could also put my email in the chat, but if anyone wants to dialogue more on ways we can work together on some of this, I would be happy to connect.
We did have a question about which screening tool that you're using, and if you'd be willing to share that screening tool.
Sure. So we are taking a lot of, for the HRSA project, we're taking a lot of the guidance from what has already been developed and, you know, approved as a, what's the word I'm looking for? Validated screening tools that are out there. So we have a prenatal cohort and we have pediatric cohort. So of course, a lot of us are familiar with the validated screening tools for screening for alcohol use during pregnancy. There's less there for pediatric screening. So then we are bringing in the Bright Futures guidelines from the AAP and also the AAP guidelines for FASD screening and diagnosis that they've created, so that we're using those. They're maybe not to the point where they're a validated screening tool, but it is guidance that, you know, is coming from those committees. We have FASD champions from the AAP in the project. We also have FASD champions from ACOG in the project as well. So all of the recommendations are aligning with those same recommendations that are in those federal arenas. So it's not, and we're presenting them, and we're not, you know, requiring this is the one and only way to do it as well. So there's that happening too.
Other questions you have?
Hi, Julia. Amazing talk. Thank you so much. Once again, just the extraordinary work that Proof Alliance is doing, and just really appreciate the real world, practical, and sort of morale boosting nature of how you talk with folks, try to recruit them to be involved. How do you? Couple questions maybe. How do you see being able to share with clinicians or a clinical setting the fact that you know, you have then other resources should they begin a project and start to identify women and individuals who need support? How important is it for you to be able to say, well, we can help you there as a referral network? And I guess lastly, come on, that your garden, if I heard you yours, that is sort of off the hook in terms of, I don't know, you must have a number of children or neighbors who pick weeds or something, but I mean, come on, you put us to shame on that, but
Oh, thank you.
for the project.
Yeah. Well, with the garden, I'm the assistant gardener. My husband is the official gardener, and we have two reluctant children that will occasionally help. Very reluctant. With respect to the other question, you know, I, as you can probably tell, love talking about Proof Alliance and this topic. So when I'm going into these meetings, again, I've got my goal and my agenda, but I'm also thinking about that productive advocacy and where are they at and what might they need? And, you know, whether it's, oh, I show up to the clinic, or I'm seeing something where, wow, I didn't know they had OT here, or they have this provider. I'm just making those kind of just connections in my head. So when we go into when I'm talking with someone, you know, I'm talking about how those other options and services might align with the things that we have. And you know, Kenra has really talked a lot with me about our menu of services. And I feel like it's such a good term because we really do. I mean, it personalizes it to the clinic, to the types of families or people that they are working with. So I try to use that term as well and talk about how we have so many different options and can really cater to the needs that this clinic are looking for, the needs they're looking for, the gaps that they have in terms of services. So I do try to always include that as part of the discussion as well, both from what I see and what I pick up, being in the building or talking to the clinician, as well as just letting them know that this is more than screening and diagnosis. And we have other ways that, whether it's through just handouts or information about family groups or, you know, camps or, you know, other types of support groups that they can connect families to our organization.
Julia, from a perspective of you being the clinician, and if I were trying to enlist your interest in my project and something I wanted to do, I think sometimes it's hard to tell the difference between the it's not a solid no, it's kind of not right now kind of thing, and then when it is a hard no. So is there tips that you can give us for what it might sound like from a clinician standpoint, the difference between I'm a little busy right now and no, this is not my wheelhouse, and then when would it be appropriate for us to say, I really trust your judgment? Is there somebody else that you think might fit this role or have this interest?
Mm-hmm. I think you can ask for more clarification on that. You know, you can say that we'd really like to build a connection with whatever your organization, your agency, and you know, is this like do you think this is not the right time, or is this something that is just not a good fit, you think? And so you can ask for more clarification on that. I think most people are pretty you know, open about what they're thinking and about how they're seeing their no. And, you know, you can always then, I think, parlay that into, oh, well, is there someone else at the organization that would be a better fit to talk to? But I think it is hard to read the no. And, you know, without getting more specifics on that, you're really hard pressed to know what that means, you know? So, I'm trying to be better about that myself, you know, without trying to, I don't want to, of course, insult anyone or turn them off, but sort of asking that question of, does this mean just not now? Or do you think that at some point in the future, this might be something that you could foresee, you know, building on or incorporating into your work? And then from that answer, you know, you can always take that to, well, is there anyone here that you think might be open to talking more about this? Or can you think of, do you know other providers? So getting the referrals going too, if they're not interested, if they know of other providers that this may be a better fit for, that can be another follow-up question. It looks like Rachel had a question.
Yeah, quick question. This talk was so helpful. Thank you so much. I'm asking you as a psychologist or a neuropsychologist for, you know, many of us are caregiver parents, and for many of us, advocacy is a new thing. And I found what you were saying about resistance so helpful, that it could be a good sign. Do you have tips for, and I'm saying this for myself, because many of us have hit so many barriers that we actually get triggered when we bump up against resistance. Do you have tips for caregiver parents about, you know, what do you tell yourself? What is that growth mindset when you bump up against resistance so you don't get into sort of your tiger mom mode or fierce FASD warrior mode? How do you, you know, remain open and not become sort of a fighter?
Sure. I can see how that could be very, very triggering. I think that taking that step back to use some mindfulness strategies can always be helpful, where you're really thinking about, okay, this is me, I'm having a feeling, I'm curious about this feeling, but I'm not going to necessarily engage with that feeling in the moment. What is this feeling telling me? So using some of those mindfulness strategies can be very helpful in those situations. And also thinking about the no is just erasing no, but putting in place not yet. I haven't connected to that person yet. I haven't made the inroad yet, or I haven't found the right way, you know, to build that alliance yet. So it's not a no or a never, but it's a not yet. And so doing some of that reframing cognitively can also be useful in sort of keeping things calm to the point where, okay, you're able to continue engaging, or just if you need to take a break and come back to it. But that's such a strategy for resilience in all of us, and something that I'm really working with my kids on too, is just, I know I haven't yet mastered that skill, or I haven't yet completed that the way I want to, but you know, I'm working, I'm learning, and I'm growing, and that's that growth mindset as well.
One comment I would make, and sorry, I'm having some internet problems, so that's why I'm off the video, but One thing that is a little bit of a thread line that I would just throw in as a little bit of a commentary that I see as I get an opportunity to meet with a lot of you in different projects and activities and efforts that we are all working in, and I think is so exciting, is that I think there's kind of a groundswell of energy around screening and diagnosis, and kind of really pushing as as an FASD community in like all of those different touch points where we could be screening for FASD and how that can help build capacity for FASD diagnosis. Some of you know that we passed legislation 2 years ago to require screening in Minnesota for all children entering the child welfare system to be screened for prenatal exposure to alcohol. And recently I got an email from our Department of Health who had been contacted by a pediatrician at Mayo Health Systems. And Mayo has not always embraced FASD the way that we would like them to embrace FASD. And his question is, what's going on with all these kids in foster care that are getting screened for FASD? We need to do something here at Mayo because we're getting a lot of kids coming through our system that have been flagged as potentially having FASD, and we're not doing a good job of responding to them. So I think all of that kind of collective work that we do, whether it's one clinic like Julia said, where you convince one champion to kind of jump in, all of it collectively, I think, kind of creates that snowball effect and can help change big systems in big ways. And hopefully with the passing of the FASD Respect Act, that will help shore up that all of that work that all of you have been doing and all of us have been doing as advocates all these years, where sometimes you think that one little conversation doesn't make a difference. I think it's just really cool to start seeing that happen.
Any last comments or questions for Julia in the 3 minutes that we have left?
Well, I just really want to thank you so much for the presentation. And it's just making me think that, we are advocates on so many levels, and we're sort of like advocates 24/7. It's not just legislative advocates, but it's advocates for training and education and getting more physicians involved and becoming FASD informed. And we better live a really long time, Julia, because there's a lot of work to be done.
Yes.
But thank you for helping me to remember that. And we have a state advocacy group called Monthly, and that's next Friday. So I'm going to be spreading the word of how we need to be meeting with physicians and healthcare workers and psychologists and getting them on board. And I love the idea of getting interns and doctorate residents. And that's the way, you're right, that's the way to do it and get it out there. So thank you so very much.
Thank you.
Thank you, Julia, for sharing with us today. It's always a pleasure to be able to hear the wonderful things that are going on. I'll just close this out, as Tom mentioned, the wonderful conferences that are happening, that our NOFAS Summit will be a virtual summit again this year. It will be September the 27th through the 29th, and we'll be getting our registration ready. This is the first summit where we've actually had a registration process, because you'll be required to select what sessions you're going to be attending in it. So it's super excited to see that growth on our part. So look for more information about that. And thank you so much for checking in with us today. You have Julia's email, and you can reach out to her with any follow-up questions that you may have. And we did record this session, so we'll be getting it out on our affiliate network website for you. I'm going to release you for the rest of your afternoon, and really appreciate all the hard work that you're doing for the FASD efforts across the country.